Good afternoon. I'm Sarah DeVasher Wisdom, GLI's President and CEO. I want to first thank you all for joining us this afternoon. Welcome to GLI's COVID-19 Help Resource. I know we've all been dealing with this pandemic, and it's important to recognize new best practices in our virtual environment. Not only are we having to work differently, but we're also having to live differently. And these changes really do have an impact on our mental health, from living with uncertainty of childcare to just generally trying to stay healthy. This all takes a toll on us. We're grateful to have a representative from GLI Investor, National Alliance of Mental Illness, with us this morning to discuss. Nancy Brooks is the Executive Director for NAMI, which will, and I hope I'm pronouncing that correctly. I should have asked that question in advance, Nancy, so my apologies in advance. This organization provides services to persons living with mental illness, their families, and the Louisville community. The organization also began the Stigma-Free Workplace Initiative. The initiative engages with employers in a process that promotes diverse, compassionate work environments where mental health is acknowledged and accessibility to resources is prioritized. We're excited to have Nancy with us today to not only discuss mental health in the workplace, but also how this global crisis has heightened the need for these services. I want to give you an outline for how we're going to move forward today. There is a chat feature on Zoom, which I'm sure that everyone is familiar with by this point of many weeks in working in this virtual environment. Please put any questions in the chat box, and our team will go through those throughout the session, and then at the end we'll do a facilitated, moderated Q&A. With that, all participants have been muted, and Nancy, I will hand it over to you.
Thank you, Sarah. We are so grateful to Greater Louisville, Inc. for your support and for bringing the attention of this highly important topic to those who are participating today. I think that as an organization, when we were working on implementing this new program, the Stigma-Free Workplace, we could, of course, not have foreseen the COVID-19 crisis. But now I think it's on the minds of everyone that we recognize this is going to affect our mental well-being. And lucky for us, we have a plan in place. So I'm going to switch to PowerPoint, and from there, you will only hear my voice. Okay, and as mentioned, the name of our program is the NAMI Stigma-Free Workplace. And as Sarah said, NAMI, it's okay to say it either way. I'm not a huge fan of acronyms, and this one does stand for the National Alliance on Mental Illness, our parent affiliate that is out of the DC area. Our program is unique. While the parent program created a design for this, what they were not implementing was that each individual workplace is critically unique. And so our program is intended to work with businesses based on their dynamic. If you're a large business, a small business, a business with part-time and full-time, a business who maybe for some reason is more prone to mental health issues, we will work independently with each one of you to address those issues. Again, the main goals are to reduce your cost as a business owner associated with absenteeism as it relates to mental health, and to help you create a dynamic environment for your employees that prioritizes their mental health. Knowledge is power, so understanding mental health in your workforce is the key. 40 years ago, just to give you some background on NAMI, some individuals with mental illness in their family brought the National Alliance on Mental Illness to the Louisville area. We provide education classes, support groups, and large group presentations for free normally. This new program is offering us an ability to work with other mental health providers in the community to expand the offerings to the workforce. Now, what is your definition of mental health? It's really just a person's condition in regard to their psychological and emotional well-being. One thing I like to remind people of is that we all have mental health. Mental illness is when something is a little off at the moment or for a long period of time. Again, all of us are dealing with our own sets of mental health issues, maybe psychological wounds that we haven't really addressed, or maybe an addiction of some sort. But the reality is that it's very, very common. So how does mental health impact your workforce? It is the leading cause of disability. So first off, it's a huge impact because people will, with not receiving the proper care, end up in a disabled state. We're working very hard to prevent that from happening. The loss to your company is significant financially. This particular statistic speaks nationally of 200 million work days that a company will lose based on mental health needs of their employees. And 8 out of 10 workers who are asked this question will say that the reason they don't seek professional support for their mental health is that shame and stigma still prevents them from seeking treatment. And that is one of the powers that our program will help your business eliminate, so that when that person needs some care, they're not afraid to come to you and ask. The family is also affected, and NAMI is uniquely designed to work with the entire family. We recognize the support of the family and the support of the workplace will help all individuals to improve their mental well-being. Giving everyone a tool, working together, that whole dynamic is hugely valuable in the care and recovery of an individual. So what's different now? I mean, we know that mental health is an issue. 1 in 5 individuals will seek mental health care, either therapy or medical care, every single year. So what's going to be different in the following days of the COVID pandemic? Well, I think a lot of what's going to be different will depend on, to some degree, where people were before. But we have some disorders that we believe will be more prominently displayed. So the first of those is anxiety. It's defined as a mental health disorder characterized by feelings of worry, anxiety, or fear that are strong enough to interfere with one's daily activities. So that's the key. Again, we go back to what is mental health and how we all have our own mental health concerns. We all experience anxiety. I experienced anxiety before I started this presentation. I experience anxiety when I'm in large crowds or in the elevator, but does it stop me from doing my daily activities? Not normally. So I do not need to be in care for anxiety at this point, but what we're not certain about, and this is where the COVID comes into play, is how folks are going to change how they react to their work, their community, being in public, addressing normal day-to-day activities after the fear that has been placed on them through this pandemic. So I think you're going to see people who normally would not need to be in therapy or have medications offered to them for anxiety who will start exhibiting signs of that. If you look at the magnifying glass, panic attacks is one that's underneath there. I think panic attacks could happen to anyone on any set of circumstances that would have been normal and suddenly in this environment has become abnormal. So a panic attack might relate to how a person is feeling, how they're breathing, how their body is reacting to this tension. They may sweat, they may faint. So again, we really want to be aware that many of these things that are easily put at bay in a normal environment may pop up unpredictably in our near future. So we'll get to what you can do to help that employee in the later part of this presentation. Depression is another. This again is defined as a mental health disorder characterized by persistently depressed moods or loss of interest in activities causing significant impairment to daily life. You see that impairment to your daily life again. We usually define it as having lasted for more than 2 weeks in a clinical environment, and could consist of the crying or fatigue or feeling unmotivated. One thing I'm particularly concerned, or groups that I'm particularly concerned about when it comes to depression, are the elderly and the youth. I think that maybe some of us in that mid-range will be more resilient in our return to normal life. In fact, we may be happy that we're going back to our normal life. But the elderly are still in danger, so they're still going to be isolated, and isolation leads to depression. The loneliness that they experience also leads to depression. So as a community, I'm hoping to find some resources that we can share with those folks as we all transition to what we hope is normal, but they may not. And our youth, again, they have not experienced as long a history of normal as we have. So in their timeline, experiencing this enormously disruptive environmental condition that we are all in, this pandemic, how will they react to that? How will they see the future? And I'm guessing that some of them will experience depression in fears that this is their norm. If you see an employee who is experiencing depression, it will be fairly easy to tell. In fact, you may see some loss of time in the initial parts of it where they just can't make it to work. Again, we'll talk about resourcing that individual to help it later in this presentation. Another symptom that I think we will see more of is PTSD, which is post-traumatic stress disorder. And the symptoms may include anything from nightmares to unwanted memories of the trauma, avoidance of situations that maybe bring back memories of the trauma or heighten the reaction, anxiety, or mood depression. All of this is something that, based on a person's previous experiences, will warrant an episode of PTSD. So we a lot of times think of it as a war veteran who might have flashbacks or fears or bad nightmares over their experience. It doesn't always have to be that way. Sometimes youth who live in violent communities will experience PTSD and have no idea they're experiencing it because they're young and this is all they've ever known. I believe that what normally would create a PTSD, looking at these severe traumas and these severe situations, will definitely continue to do so. So if someone's living in a traumatic environment during this, if a person has a substance use disorder and they're more likely to be drinking during their time at home than they were before, it might heighten their disorder. Or if they are into pharmaceutical substance use, the same thing. However, the PTSD that we might see in the workplace, I believe, will be related to just the fact that we've all experienced some form of trauma during this time. We're seeing many, many people who have been laid off. Should most of those go back to work, that doesn't mean that their fear or anxiety of being laid off again isn't already there. So while it's mild compared to a war veteran, it's still a form of post-traumatic stress. The same with our overall fear of the economy or fear of the COVID-19 virus itself. we have to respect that that is part of our new thinking and that cognitively symptoms could show up. I think one of the biggest things you would see about this in the workplace might be that avoidance of a situation that used to be commonplace. Someone who suddenly doesn't want to go to coffee house meetings, but will only meet on Zoom, for example. They may be experiencing something that they might want to have a discussion with a therapist and see if they can work their way through it. Or the anxiety and the mood depressions. Now, suicide is a huge issue that is plaguing our youth and really all of our community. And the city of Louisville's Louisville Health Advisory Board has been working on this for a long time. One of the offerings that we're offering within our stigma-free program is a QPR suicide prevention training. It stands for question, persuade, and refer. And basically, you're just trying to continue to work through the relationship with the individual who may have suicidal thoughts. What are they going to be seeing? There's a whole litany here. Feeling overwhelmed, lack of hope is a huge, huge part of suicide. There are going to be many people who feel hopeless from the experience that we are all having. Having a family history is one of those precursors. And impulsive behavior might be a symptom or a sign. Is there a history of substance abuse? Do they have access to firearms? Recent difficult life events such as a divorce or loss of their job or even loss of a life-changing activity like the students who aren't getting to graduate. That could be a trigger for someone to have depression and suicidal thoughts. Are they isolated from others? Yes, again, we've already talked about the elderly and how that might relate to them. History of mental illness, history of physical or sexual abuse, having a terminal or chronic illness, and a past suicide attempt. All these things are things we would want to look for. I think one of the beauties of the stigma-free workplace is that once you get that cohesive dynamic going within your workplace where people are open and talking about and sharing their concerns or their mental health with their coworkers, boss, or upper management, you are going to be able to address these needs as folks who we already partner with have experienced. We have a restaurant that had an individual come to them and say that they were feeling suicidal, and they called our office. We answered the phone. We said, let's get on this. This is always take a suicide threat seriously. Let's get you to the nearest hospital and let's make sure that that person is taken in for an assessment of their health. We don't want to let someone go home if they're thinking suicidal thoughts. So in partnering with this business, we were able to direct them to the right resource. Because we had people on the inside, we were able to call Our Lady of Peace, or now Peace Hospital, and let them know we were sending a referral over. They made sure that person got the help that they needed. And the business owner's response to that to us was, thank goodness we had that relationship, because now we're talking as a team. We're like a family. And that's the sort of environment that an individual is going to need as they go back into the workplace and these thoughts or anxieties or depressions occur. They need to have some place that is safe for them to share. So what is the NAMI stigma-free workplace? It's sort of an employee benefit. We want to work closely with your human resources department to make sure that the employees are receiving these services, most of which are free, some of which have expenses, but all of which will help supplement the fact that most provider benefits pay less for mental health concerns than they do for physical health concerns. which in this day and time, so much of that is intertwined, and we know it. We know that our physical well-being is tied into our mental well-being, but the providers haven't really adapted to that equalness or importance of the mental health side of things. So we will offer support and education to the employees and to their family members. We will promote what we call stage zero intervention. Sorry for stumbling on that. But we don't want anyone to get in a situation where they've had a full-blown mental health condition and need further care. We want to address it in its early stages where we can get them the help that they need prior to it becoming a life-altering episode. So how can we empower the communities? Through some of the programs that we will offer, and we know that these are life-changing programs. So some of the ones we offer regularly, we have 3 educational classes, Family to Family, as a course for any family member or close friend of an individual who's suffering with a mental health condition. And they are educated on everything they could possibly know to fully support their family member or friend. Basics is circled around parents who are educated to support their child who is facing mental illness. The child does not have to have a full-blown diagnosis for the family member to be able to participate in this class. They just have to see signs and symptoms that are concerning them. The beauty of all of our programs is that they are peer designed, and so the groups are led by individuals who will understand where you're coming from because they're part of your peer group. Homefront is specifically designed for family members of military. We also do the support groups. Connection is a peer-led support group for adults with mental illness and family support for their family members. And we do various presentations. We can offer these to your workplace. We can offer them online. At this point, everything can be offered online. So in our voice is someone speaking and sharing their life story. Ending the Silence is focusing more with the youth in the school level. And we do have a youth advisory council who their first program design is a youth support group ages 18 to 24. We have the QPR suicide prevention training, which was mentioned earlier, and our stigma-free workplace offerings. So these are all part of what you automatically get if you sign on as a stigma-free workplace. So we want to transform you through our partnership. We want the leaders in this movement to end stigma, and we know that will empower your workforce. It's a win-win for the employers and the employees because we're going to increase productivity and create healthier work environments. We're going to decrease the impact on your business of disability. We'll increase retention and engagement of your valued employees. You're not going to lose someone. You're not going to have to keep working to train new individuals because someone has had to leave because of a mental health condition. And overall, that's going to strengthen the company's brand by linking you with this cause that right now is just, it's on the forefront of everyone's minds. So being a workplace that has that culture and has created those values will be huge for your reputation moving forward. So NAMI Stigma-Free Workplace provides, as I mentioned, all those services we already talked about, but in addition to that, we want to host kickoff event with your staff so that they know they're becoming a stigma-free workplace, and it helps to start that dialogue. Maybe it's a similar presentation to this where everyone just logs on and they hear more about the offerings and they know where they can seek support. We offer program materials and mental health guides, and you can keep those in your office or in your HR department or wherever it seems best to have those. Maybe it's a lunchroom. We have some templates we can share about how within the business you can communicate with employees. We can also be sharing out a quarterly newsletter that will help you. We share it to whoever you want to act as your lead at your workplace, and then they would share it out to others. And you'd be certified as a stigma-free workplace. We'd promote you based on that as well, and other benefits that are tier level benefits. So basically what we have is 4 different tier options, and it really depends not on the size of the business, but on the demand the business wants to put on this, how much they want to be supporting their work employees and environment as a stigma-free company. The bronze level, tier 1, would be basically providing you with the information, providing you with any free opportunities that already exist. If you wanted to go a little bit farther, you would still get those offerings, but then you would have the kickoff meeting. You'd be provided additional materials that you could share with your workforce. You could also have materials that are stigma-free product that you could distribute. So, people could have water bottles, that kind of thing. Gold level is all that's in tier 1 and tier 2, but also implements the valuable partnership of the employee and the organization. We'd host an annual program geared directly towards your employees and their families, depending on what you want us to focus on. I mean, we'll do the research, we'll get the data, and we'll present whatever someone is interested in having presented. We'll actively promote your organization. And in the top tier, you would be delivered exceptional levels of support. In fact, we would assign a team member to really be kind of available at all times for you, so that if anything were needed. This will come into play with any level business, but if you're a large business, it would probably work best in this environment. And that person would be, maybe a 15-hour-a-week NAMI employee who's servicing your programs and actively promote and recognize your organization again. So what would it take to become a champion and a sponsor of your employees? Well, the things you're going to be offered are the free programs we already talked about, the presentations we already talked about, but additionally, we're going to be offering you resources both locally and regionally to meet the needs of your employees, similarly to what we did with the restaurant employee and Peace Hospital. If you come to us and say, we've got someone, their issue substance use disorder, and we love this person, we think they're a valued employee, the last thing we want to do is lose them, but we think that they might want to hear about some resources that might be able to help them. Well, then of course, we might look regionally for something like that. Just depends on the need of the individual. And then how do you become a stigma-free workplace and help your employees? You just complete a NAMI stigma-free workplace commitment form. Now, this is where I want to tell you, I understand you're all from different businesses and you're all unique. And I would prefer to meet and talk with each one of you about your specific needs so that we could choose the right level that's right for you. I have not included any dollar amounts in this presentation because we are willing, for those who are having extreme financial concerns at this time, to work with you free for the time being and sort of show you our honor and show you that we're willing to work with you. If you have something to give, but you feel it's not much, then we'll work with you where we can. And for those who want to be full on supported and really want to have that employee focusing on them, then we would probably go with a higher tier. So then you choose your tier. And again, you would coordinate with us to develop whatever program you want. And we always want to do that kickoff meeting because we always want your employees to know that you're committed to them and that their mental health really matters to you. That's pretty much the general presentation. I know we're going to have some questions afterwards, and I look forward to all of you reaching out to me. I am sure that if this does not save and you can't get this information down, that GLI will share out our contact information with you. So please get in touch with us and we can talk specifically with you about the needs of your workplace. Thank you, and I guess we're going to questions next.
Yes, thank you, Nancy. That was a very, very informative presentation. Do have a few questions that have come in here, so I'll just get started. Beyond the obvious HR lines of division, what are some ways that a peer or a manager can support an individual who may be showing these signs of anxiety or mental health struggles?
Okay, obviously talking is the first step, and that's what a big part of this is about, having that open dialogue. Many people who are suffering with mental health conditions still exhibit those signs of stigma. They don't want to tell you what they're struggling with because of their fear or their anxiety. So being open and being really positive and non-threatening is the best way to get someone to truly be honest with you about their concerns. And then from there, whatever their concerns are, that's where we start finding the right resources. You know, should it just be that someone's saying, I'm really feeling anxious in my work environment because I'm used to working at home, and now I'm back and I hear the noises differently? Well, maybe it's as simple as, you know, one of those noise machines that drowns out the other noises, or maybe it's building a cubicle in this environment that didn't exist before. But maybe it's bigger than that. Maybe the person is struggling more deeply. And in that case, what we would want to do is actually talk to them about seeking some support of some type, whether it's a therapy visit or, you know, going to a support group and talking to other folks who are dealing with similar things.
And have you noticed any differences between the electronic sessions or the virtual sessions that mental health providers may be hosting versus the in-person sessions?
Well, it's interesting that you ask, because I've just started to ask people how they're perceiving that. One of the doctors that I talked to, I thought it was very interesting how they were managing this. This was a psychiatrist at U of L, and they were working through their visits by going to different rooms. So when you came in, you were in the waiting room and you were checking in with a different staff member. Then when it was your turn to go see the doctor, you left that meeting to go into the office meeting. And then when you came out, you met with yet a different person who scheduled your next appointment or helped you with medications or whatever. So I think that was a very positive example of how you can make it feel more normal. We are, in our support groups, for a different example, we are really only just now seeing the numbers coming back up. It was very hard to get people comfortable with the technology and feeling that they could voice their concerns in the same way that they did when they were in person. But because those numbers are coming back up, I'm hopeful that this is working for them as well. Now, probably the bleakest version I've heard is that many therapists are seeing much less activity, folks who are not as comfortable coming to their virtual office as they were in person. So I think that group, it would very much benefit them to be able to be back one-on-one. But otherwise, I think that it is becoming a new norm and we're getting comfortable with it.
Good. I'm very glad to hear that. And hopefully the pace will pick up so that people begin joining those sessions, whereas they haven't been. What about if somebody isn't ready to go to a mental health professional? Is there some guidance for individuals to do?
Yeah, I'm a huge proponent of self-help. I think most of us can get through with self-help, but we shouldn't not do that. And so is it reading articles or picking up a book or going to some sort of a chat room where there's other people dealing with the same situation? One of the topics we've talked about recently as kind of showing an increase is grief. So if grief is showing an increase in this time, then we want to direct people to a group that's focused on grief. We don't want to send them to a group that's focused on substance abuse, for example. It's not going to benefit them. They're not going to have that peer-to-peer relationship. So it's about building those communities. And again, the Louisville Health Advisory Board is working to try to figure out how that looks within the mental health community here in Louisville, so that as people experience these symptoms and they're in need of something, we're not confused about where to send people. We're working together. We're building strength within one part so that the other parts all have strength as well.
Excellent. What about employers that really want to be proactive, but many might not have the answers to what their own business practice is going to be, and that may be a cause of stress for the employee? What would you advise employers to do in situations like that, where they're being proactive, not just reactive and giving people the opportunity to talk?
Well, I think the first thing I would want them to do is to at least give us a call and have a real conversation about what their needs are. A good example is that a local theater group has many issues right now that they're seeing in their employees. And so they've asked us to be very specific in a presentation for them that will address exactly what they are seeing in their particular work environment. So that's what we want to do. We don't want to just share this particular presentation with every group that we talk to. We want to know what their particular needs are, what the pulse of their organization is, what brings people to their business. Why do people want to work there? That helps us understand who their employees are and how to streamline with our, key partner within the business. That's really important that we get that one person that wants to work with us. I'll share this business's name, but Aetna Better Health of Kentucky is a partner for Stigma Free, and they've assigned one person to be their key person. So we work with her, we talk with her about what she thinks, and that helps us to design the products that they desire or need.
That's great. Do you think this crisis has really helped us to elevate this as a topic?
Well, it's interesting. I have been writing things for events that we aren't having that I was already in belief that this was the time for mental health. And if you guys will just let me kind of go off topic just for a second. When you look at history of physical health, and there was just a time when it exploded, right? Where suddenly penicillin was a thing and people were able to manage physical health so differently than they were before that time. I think this is that time in mental health already. I think this is the time when our society is saying we have to figure this out. We have to find a better way. What we've been doing might not be working, or might not be working as well as we would like it to. So this is a time where we have to put our attention to mental health. And if COVID's the reason we're doing it, then I'm automatically going to see that as a positive in our change in our world thinking. Because when we put our minds to things, we do make improvements. The cancer rates have gone down. Death by cancer, death by diabetes rates have gone down. But death by suicide is higher. Death by Alzheimer's is higher. We're not putting our minds and our scientists to use in the field of mental health the way we've put them in fields of cancer or heart disease or something else. By putting our attention to something, we will change it for the better. So.
Absolutely. Are there any concerns that employers should look for, like red flags through telework, anything that employers should just be watching out for in their employees?
Well, there are some things that people shouldn't be doing, and I think a lot of that has been out there publicly. We shouldn't overconsume the news. That's not mentally healthy for us. We shouldn't lose touch with people. We should try to continue to have relationships even though they're virtual. Get exercise, eat right. For me, my biggest thing is get out of bed and put on some clothes and do a little bit of something to yourself so you feel like you're going to work. If you don't, I think there's that inkling of depression that does sort of come in. What am I doing still sitting in my jammies at noon, right?
Well, I'm glad you pointed that out. And for the GLI staff on the call, on our full staff call tomorrow, I'll be looking to see who's wearing pajamas. Oh, gotta watch for that.
I had the same thing, and I've heard some really funny stories about what people are seeing people do during Zoom meetings. So I think that's a sign of where somebody might be. If they're not really pulled together or paying attention, maybe that's a concern.
Well, in thinking about employer assistance programs, how does this resource compare to what an employer assistance program might offer?
Well, with the normal, again, I think what we're trying to do is supplement the cost prohibitive. Mm-hmm. A lot of times the insurance is not going to cover mental health at the same level as physical health. So what are we trying to do? Find you some low-cost alternatives or free alternatives that you can offer your employees so that they're not just not going because they know that out of pocket it's going to be $100 to see this doctor or this therapist. We would rather find them a place where they can go at a low cost or at a free cost to at least get some service. And of course, the goal is always for them to be fully healthy. So if they need something more, we're still going to try to get them encouraged to seek that extra help.
Sure. Well, I think that addresses all of our questions that we received, but this has been very, very informative. So thank you for joining us. And for those of you who are on the call, I want to share a few updates from GLI. We have been providing a resource called a Crisis Support Hub. You can purchase PPE on it. I know we're all talking about reopening, but many businesses need masks in order to do that. So we have also acquired a small supply of masks if the wait is too long on the PPE site. But crisissupporthub.org. This webinar will also be posted on the site. You will be receiving an event survey later this afternoon, and that will also include the recording. Let's see, I think that was the only update I really had there. So thank you all for being here today. We're all going to get through this, and we appreciate you joining us. If you have any interesting ideas for more webinars, please just let us know.
I will gladly do that. And anyone that needs us, please reach out.
Thank you.
Thank you.